Hi guys, welcome to my Biocast. In these videos, I bring you some of the most talked about stories in biotech over the past month. But as well as letting you know what I think about them, I would love to know what your opinions are too. So let me know what you think about this story or any of the stories I've covered in my Biocast in the comments down below. And the story I'm going to talk about today is using MDMA to treat PTSD. Now, a quick disclaimer before I get into the story, I am not endorsing using ecstasy, MDMA, or any other restricted substances recreationally. They're illegal and can be really dangerous if laced with something harmful. But with that said, let's get into the story. Research using MDMA-assisted psychotherapy for post-traumatic stress disorder, or PTSD, has progressed onto phase 3 clinical trials. If the research meets its primary endpoints in the phase 3 trials, the FDA may approve MDMA-assisted treatment as a legal prescriptable treatment for PTSD. Nearly 4% of all people worldwide will suffer from PTSD in their lifetime, with symptoms including intrusive thoughts and memories and depression. So with promising results from phase 2 trials, why has there been contention around this research? MDMA, or methylene dioxymethamphetamine, is a synthetic drug which is commonly known as ecstasy or Molly. It boosts chemicals like serotonin and oxytocin while dampening down activity in the amygdala, the part of the brain that processes fear. It was discovered in 1912 and its therapeutic benefits were largely studied in the 1970s. However, due to the increase of recreational use and abuse, MDMA was designated a Schedule I drug in 1985 and the US government stopped its research. But since the early 2000s, there's been a renewed interest in psychedelics for the treatment of various disorders such as opioid addiction, anxiety, depression, and PTSD from privately funded organizations. In August 2016, the FDA granted breakthrough therapy designation to MDMA for the treatment of PTSD. Results from the phase 2 clinical trials, funded by the Multidisciplinary Association for Psychedelic Studies, or MAPS, involved 107 participants with chronic treatment-resistant PTSD, and showed that after 3 sessions of MDMA-assisted psychotherapy, 61% no longer qualified for PTSD 2 months following treatment. At the 12-month follow-up, 68% of participants no longer had PTSD. The trial showed that MDMA can reduce fear and defensiveness, enhance communication and introspection, and increase empathy and compassion. Laurie Tipton was a participant in the trial and described her treatment with MDMA as transformative. A year after her treatment, she no longer had PTSD and believes that the treatment saved her life. She says, "In the embrace of MDMA, I was able to find empathy for myself. Everything is at my fingertips for me in a way that it never was before. I want that for everybody." Scientists outside the trials have also endorsed the research, with Professor David Nutt, head of the Center for Neuropsychopharmacology at Imperial College, saying, "This is the biggest breakthrough in medicinal PTSD treatment for 2 decades. There is good neuroscience evidence for how this might work. Our research shows that MDMA reduces negative memories and suppresses amygdala activity and connectivity in healthy volunteers. This is a very sophisticated combination of MDMA with intensive psychotherapy sessions with 2 skilled PTSD therapists, not something to be tried at home." Dr. James Stone, clinical senior lecturer at the Institute of Psychiatry, Psychology and Neuroscience at King's College in London, adds, "It is exciting because this would be the first time in decades that such an approach has been used for the treatment of mental illness. The results of the phase 3 trials, predicted to be due in 2021, will determine whether MDMA-assisted psychotherapy might be used more widely in the treatment of PTSD. In July 2018, MAPS and the FDA reached an agreement on the Special Protocol Assessment for MAPS-funded phase 3 clinical trials, confirming the trial aspects needed to support regulatory approval by the FDA. The trial will take place at 15 research sites in the US, Canada, and Israel. And participants in the main portion of the trial will be randomized to receive 3 sessions of either MDMA or placebo in conjunction with psychotherapy over a 12-week treatment period, along with non-drug preparatory and integration sessions. MDMA isn't the only restricted psychostimulant that is being investigated for therapeutic use though. Johns Hopkins Medicine has recently announced that they plan to open the first center for psychedelic research in the US to investigate the use of LSD, psilocybin, and other psychedelics to treat a host of disorders, including opioid addiction, Alzheimer's, and PTSD. However, as there are still significant legal hurdles in the way of obtaining government funding, this centre and other psychedelic research in the US will have to be entirely privately funded. So my take on this story is that this research is super exciting and really promising, and it has a lot of potential. And it also reminds me of TV shows like Fringe and Stranger Things. So yes, there were some negative side effects to this treatment, like suicidal ideation and cardiac problems in phase 2 trials, although these were extremely rare and non-life-threatening. And when you weigh that against curing PTSD and the fact that every other treatment in the world carries some form of risk, it seems silly not to progress these trials. The main controversy around this treatment centres on the legal status of these substances, which has severely restricted the funding for MDMA trials and research into other psychedelics. And in my opinion, it's a shame. These substances have so much potential when applied in the right setting and in the right dose. And the war on drugs in the US hasn't had much of an impact on the prevalence of drug use in general over the past 10 years. So why not relax the restrictions and taboo around testing and find treatments that will help millions of people with currently untreatable disorders? Of course, that is just my opinion, but what is your take on it? Do you think that the potential of these drugs to cure disorders that we can't currently treat is worth it? Or do you think that there's a risk of normalising or even glamorising the use of illegal substances if the government starts funding research into psychedelics? This is one of the more controversial stories I think I've covered in the Biocast, so I'd be really interested to hear what you guys think. So with that, we come to the end of the story and the end of the video. So thank you so much for watching, and if you think there's a story I really should cover in the world of biotech, leave me a comment down below. If you want to catch up on any of the other stories I've covered in my Biocast, you can go and check out the Biocast playlist here on YouTube. And if you've not got time to watch a video, then don't you worry. I've put the Biocast available in audio format on all of your favourite streaming platforms. You're welcome. But once again, thank you so much for watching or listening. Have a beautiful day like it is here in sunny Glasgow, and I'll see you on my next Biocast.